Doctor, you mentioned pemphigus? Yes, I did. What is exactly pemphigus? Well, it has to do with blisters. Doctor, is it a form of dermatitis? Yes, it is. And in which a bullous eruption develops? Yes, but they are distinguished from true bullous diseases by a short duration and good prognosis. And the term pemphigus, doctor, is derived from what? It is derived from the Greek pemphix, which is blister, and points up the chief characteristic of pemphigus vulgaris, namely the formation of blisters. Doctor, these are blebs, are they? Yes, you could call them blebs, which arise suddenly on apparently normal or slightly erythematous skin and form oval-shaped or round blisters containing clear serum. Doctor, do these blisters tend to be flaccid and to break early? Well, the epidermis becomes detached and leaves increasingly larger areas of denudation. And doctor, the Nikolsky sign is always positive, is it? Well, the Nikolsky sign is obtained by pressing on the skin with the fingertip. And the epidermis, doctor, then slides off and a raw surface remains? Not exactly. The denuded areas are slow in healing and constitute a continuous threat of infection. Dr. Pemphigus, however, has been compared with a serious burn, has it not? Yes, but in reality, the trauma of a burn is a single occasion and the lesion is frequently localized. On the other hand, the injury inflicted upon the skin by numerous crops of bully, followed by widespread denudation, presents a still graver problem than that of many a burn. Doctor, the blisters vary in size, do they? Yes, they vary in size from a few millimeters in diameter to 10 centimeters. And the new lesions, doctor, develop while old ones disappear? Well, I wouldn't put it that way, since the crops arise rapidly, often overnight, and old lesions heal slowly. The areas of denudation are extensive. And doctor, finally, crusts form, do they? Yes, crusts do form over the raw surface. If the pyogenic bacteria get beneath these crusts, doctor, is there a smell that develops? Yes, the smelling pus collects and increases the patient's physical distress. Doctor, there is no scarring, however, in a hyperpigmented lesion which remains after healing. Is that true? Well, the formation of bully in the oral cavity particularly are painful. Blebs about 5 millimeters in diameter are scattered over the buccal fossa. Doctor, do they appear spontaneously? Well, they rupture spontaneously and leave raw ulcers which inflict much pain. Doctor, was there also an occurrence of other orificial mucous membranes? Yes, the etiology of pemphigus is still unknown, however. Some authorities believe that it is metabolic or caused by bacterial or viral infections. However, no theory has yielded convincing evidence. Doctor, the common type of pemphigus is a chronic recurrent disease, is it? Yes, but it is afflicting only adults with minute exacerbations which may be followed by brief or prolonged periods of remission. As a rule, pemphigus vulgaris lasts from several months to years. Untreated, it is a fatal disease, but with the judicious use of cortisone, the prognosis is indeed favorable. Have you ever had anything on pemphigus?